The increasing consumption of ultra-processed foods has become a major public health concern, with growing evidence linking these products to severe health risks, chronic diseases, and premature mortality. While their convenience, affordability, and appealing taste have made them a staple in modern diets, the long-term consequences of their regular intake are alarming. Research continues to reveal how these highly processed foods, packed with artificial additives, refined sugars, unhealthy fats, and chemical preservatives, are significantly contributing to a global health crisis. The ease of access and the aggressive marketing strategies behind these products have led to their dominance in supermarkets, fast food chains, and even school cafeterias, making it increasingly difficult for individuals to maintain a healthy diet. A large-scale study published in the Lancet Regional Health, Americas in September 2024 examined more than 200,000 adults in the United States and found a strong correlation between the consumption of ultra-processed foods and cardiovascular diseases. Individuals with a high intake of these products showed an 11% increased risk of developing heart disease and a 16% greater likelihood of suffering from coronary artery disease. These statistics are not just numbers. They represent millions of people facing a significantly higher probability of life-threatening conditions due to dietary choices shaped by convenience rather than nutrition. The dangers extend beyond heart disease. Another analysis, which included 1.25 million people, found that individuals who consumed high amounts of ultra-processed foods had a 9% higher risk of suffering a stroke. This suggests that the cumulative effect of these foods is not only damaging the cardiovascular system, but also affecting brain health, increasing the likelihood of catastrophic medical events. The impact on mortality rates is equally concerning. At the annual meeting of the American Society for Nutrition in July 2024, researchers presented findings based on data from over 500,000 adults, concluding that high consumption of ultra-processed foods is linked to a significant increase in death rates from all causes. This association is particularly strong for deaths resulting from cardiovascular diseases and diabetes, two of the leading causes of mortality worldwide. The evidence suggests that the damage caused by these foods is not merely an increased risk of developing chronic illnesses, but a measurable reduction in lifespan. The effects are especially severe when consumption includes ultra-processed meats and sugary beverages, which have been linked to a greater likelihood of early death. Another long-term study published in the BMJ in May 2024 followed more than 100,000 individuals over 3 decades, reinforcing the idea that diets rich in ultra-processed foods contribute to higher mortality rates. The study emphasized that the combination of chemical additives, excessive sugar content, and refined carbohydrates creates a perfect storm for metabolic disorders, obesity, and systemic inflammation, all of which accelerate the progression of life-threatening diseases. The role of these foods in fueling obesity cannot be overstated. Ultra-processed products are engineered to be hyperpalatable, triggering excessive consumption through artificial flavor enhancers and addictive sugar-fat combinations. The result is an epidemic of overeating, leading to widespread metabolic disorders, insulin resistance, and a steady rise in obesity rates across all age groups. The dangers extend beyond physical health. Recent studies have highlighted a disturbing link between ultra-processed food consumption and mental health disorders. Individuals with diets high in these foods have been found to be at increased risk for depression, anxiety, and cognitive decline. The mechanisms behind this link include chronic inflammation, gut microbiome imbalances, and blood sugar fluctuations, all of which can negatively impact brain function. The presence of artificial chemicals and emulsifiers in ultra-processed foods has been associated with disruptions in neurotransmitter activity, leading to mood disorders and even an increased risk of neurodegenerative diseases, such as Alzheimer's. One of the most troubling aspects of this issue is the widespread consumption of ultra-processed foods among children and adolescents. With aggressive marketing campaigns targeting younger audiences, these products have become a daily staple in school lunches and home pantries. Early exposure to these foods not only establishes unhealthy eating habits, but also increases the risk of developing chronic diseases at a much younger age. Studies show that children who consume high amounts of ultra-processed foods are more likely to experience obesity, attention disorders, and poor academic performance due to fluctuations in blood sugar levels affecting concentration and cognitive function. Despite mounting evidence of the dangers posed by ultra-processed foods, their consumption continues to rise at an alarming rate. Food manufacturers invest billions in advertising to create an illusion of healthiness, using misleading labels such as natural flavors, fortified with vitamins, or low fat to deceive consumers into believing they are making healthier choices. In reality, these products are often stripped of natural nutrients and artificially enhanced with synthetic compounds that do little to nourish the body. Government policies and public health initiatives have struggled to curb the dominance of ultra-processed foods in the market as corporate interests and profit-driven motives continue to take precedence over consumer well-being. The accessibility and affordability of ultra-processed foods make them particularly appealing to lower-income populations, exacerbating health disparities. Many communities with limited access to fresh, whole foods rely heavily on processed products, leading to higher rates of obesity, diabetes, and heart disease in socioeconomically disadvantaged groups. The economic burden of these diet-related diseases is immense, with healthcare systems worldwide struggling to manage the rising costs associated with treating preventable conditions. The growing body of research underscores the urgent need for dietary changes. Experts emphasize that reducing the consumption of ultra-processed foods and prioritizing whole, minimally processed ingredients is crucial for long-term health. This involves making conscious food choices, reading ingredient labels carefully, and opting for fresh, nutrient-dense alternatives whenever possible. However, breaking free from ultra-processed food dependence requires more than individual efforts. It demands systemic change. Governments must implement stricter regulations on food labeling, advertising, and the inclusion of harmful additives, while schools and workplaces should promote healthier eating environments. If current trends continue, the consequences could be devastating for future generations. The rise in diet-related diseases, the decline in cognitive function, and the erosion of traditional eating habits all point to a future where preventable illnesses become the norm rather than the exception. The shift toward ultra-processed food consumption is not just a dietary issue, it is a public health crisis that requires immediate action. Without significant changes in how food is produced, marketed, and consumed, societies will continue to face escalating health problems, reduced life expectancy, and an increasing reliance on medical interventions to manage conditions that could have been prevented through better nutrition.